everywhere, and we have a very special treat for you today. So I'm very excited about that, and I appreciate the time you are taking to join us. These have just been crazy times, and during these times, we've had so many problems. There's a new article out today about how depression has tripled. And as a part of that, addiction is going up. People are drinking more when they're stuck at home or when they're worried about bills. The social, justice issues have caused people to, turn to substances even more, and because of the anxiety. So today I have a very special guest for you, Dr. Cali Estes, who I'm really excited about having here. She has a great book called I Married a Junkie. And I just love this when I saw it because it reminded me so much of my own life, not the married part, but just having so much addiction in my own family. And so I really wanted to have her as a guest. And she's a highly sought after addiction specialist. She's got a PhD from DSU and in psychology and life coaching. She's got over 20 years of experience working with drug, alcohol, and food addictions. And she's also a personal trainer with yoga and Pilates. So she's been featured on CNN, NBC, CBS, Fox News, and the Dr. Drew Show, and many more. So she's highly sought after, and I'm so appreciative that she took the time to be here today. So, Dr. Estes, welcome. You have this book about how you married a junkie, and my first question to you is, are you still married?
We are, yeah.
That's amazing. How long have you been married?
Together 10 years. Together 12, married 10. So
that's amazing.
Our 10-year anniversary.
And you actually figured out how to work through that. And I think a lot of people are going to be interested in hearing what you have to say on this because it's such an important topic. So addiction causes so much turmoil in people's lives, as you know. And I mean, especially if you're probably married to someone, it's really troubling in your relationship. So first of all, tell me what inspired you to write this book. Tell us about your book.
So I have a unique kind of experience because I've been a clinician in, the addiction space for 20 some years, and I've always done this. And during my relationship with my husband, he had never done heroin. He wasn't addicted to heroin or painkillers or any of that, and sort of caught me off guard. Out of nowhere, he started using Oxycontin, which quickly led to heroin. And he had overdosed multiple times and crashed the car multiple times. And then when he got sober, we sort of said, what should we do? We should write this book. But there's kind of also an underlying premise as I was doing, building my private practice. Here I am helping celebrities get sober, and he's out using drugs. Mm-hmm. And one of my competitors sort of thought that was kind of unique and kind of ran with it on social media to trash me. And he said, well, her husband is a junkie. What kind of therapist has a husband that's a junkie? And we both went, I wonder what a good title that would be. So we took the title and used the title. And then when we wrote the book, sent him a little thank you note and sent the book. Fantastic. Yeah. So that's how it came about. Great.
Well, success is the best revenge. We all know that. So good for you. And I just want to applaud you for not hiding and for being vulnerable and coming out and talking to people, because our audience is, this is what we do. I mean, at the Amen clinics, this is what we do. We treat addiction, and we always say, like in my new book, I have a new book coming out in January called The Relentless Courage of a Scared Child. And that's why your book sort of resonated with me. One of my first memories was my uncle being murdered, and I didn't see him murdered, but I remember the police coming to the door, and my mother and my grandmother just screaming and sobbing. And it was very traumatic. And it was because of a drug deal gone wrong. So it's a very disruptive thing when people in your family, and I still have a lot of addiction in my family. So I've got many family members who still struggle. And so it's just so hard. And when you grow up in chaos or you have chaos in your marriage, I think the normal reaction is to try to hide and to try to cover it up. And, I applaud you for being so vulnerable. So I know that there had to be some painful things you exposed in this. What was the reason you were willing to do that?
Well, my thought process was if we can help one person, then it's worth it, And when I decided to write the book, one of the opening lines is about my experience as a child growing up. And my father had put a gun to my head and would play Russian roulette. So there's an opening, of that. And I, kind of said to my mom, I'm going to put this book together and I'm going to put that in there. And she was horrified. She said, oh my goodness, don't tell people that. And I said, well, why not? And she's like, yeah, but you're going to bring shame to the family. And I'm thinking, there's no more shame to the family. You guys kind of already did that. So it was interesting because as I'm writing it, it was very therapeutic because it took me back to that time period, the things I had experienced and, the different triggers and coping mechanisms and things like that. And putting the book together, actually, a lot of people said it helped because they could see his point of view and my point of view, and it's written interestingly. So I talk, he talks, I talk, he talks, and it's kind of like we had opposite childhoods, and yet, we ended up together. So it's an interesting story.
No, I love that. And I can relate when you start trying to write a book about people and they're alive. Writing a memoir was really interesting. So I can relate to that. And I applaud you for working through that. So tell me something. You are a clinical psychologist and you got criticized for this, but how did you miss the signs that he was a junkie?
So I was traveling a lot. I had a lot of private clients. And the first time I was in Vegas with a private client for the weekend, doing my thing, and I called home 10 o'clock in the morning, and he answered the phone, and he sounded drunk. And he wasn't a big drinker, so I thought, this is weird. But maybe, is he sick? Is something going on? And then about 2 hours later, I tried to call him, and he didn't answer the phone. And that went on all day. And I called his father, and I was concerned. And then he called me yelling at me. Why are you having people call me? Why are you tracking me down? And I'm thinking, none of this behavior is normal. It was weird. So that was my first kind of something's off. But he had been able to maintain because back then oxys were $3 a pill. He wasn't pawning things and stealing and, using the credit cards. He wasn't doing that. It wasn't until they became $35 a pill and he couldn't, maintain that he switched to heroin. And that's when it got crazy. So I really didn't see a difference until that point.
Isn't it interesting how everyone thinks you should see it right away, but isn't it interesting how well addicts can cover it up for a while? They can't do it forever, obviously. But I'm amazed at how well addicts can cover up, people who struggle. They just find the most creative ways to hide behind it, and they become masterful at lying. And it's really hard. It's hard to detect it. It certainly has been in my own family. We've certainly had a lot of issues with that. Yeah. So why did you stay with him?
Where did I go?
Why did you stay with him? I'm sure people had to have told you this is hopeless, let it go.
Well, my thought process was I should know addiction pretty well. So I should know what to do. I should know how to handle this. So I got him a sober coach. I took him out to Colorado to detox using medical marijuana. I tried the cold turkey approach. We did the Suboxone. We did the methadone. I kind of threw everything that I would do at him that I would with a client.
Right.
And then I tried to get his family involved. Let's do this together. Let's make it a team effort. And it really didn't work until the point where I finally said, I'm done. I want a divorce. That's it. And that's when it kind of reality set in of, this isn't going to be an easy process. And I think she's done. And I said to him, listen, I'm Italian. I'm loud. I'm obnoxious. If I'm yelling at you, it's a good thing. When we get quiet, that's when you need to worry.
Yeah.
And I got quiet, and that's when he kind of said, and that's when he said, all right, I'm gonna get this under control.
So I love what you said as well. I'm Lebanese. I know I don't look Lebanese, but my mother's side of the family is from Lebanon, and we are the same way. If I'm angry and I'm yelling at you, or I'm upset about something and I'm loud about it, then I'm yelling about the situation. It's not that big of a problem. But when I get really quiet, we're done. And I had a similar situation happen with my sister who was struggling with sobriety, and she just kept doing it and lying to me. And it wasn't even the struggling with the sobriety. It was the lies that just, it's that ruining that trust that's really hard. And it was when I finally said, I love you, but I can't do this anymore. It's above my pay grade and it breaks my heart that I can't help you. And I started crying rather than being loud, and she just freaked out. And that's when she finally got serious. So, I think there's something too. And I just told her, I'm like, I'm not going to be more invested than you are. So if you're invested, I'm in. If you're not invested, I can't do this. And so I think there's something to be said for boundaries, don't you?
Well, yeah. And a lot of families I work with, I always say addiction is a family game. Everybody gets to play. So sometimes if, the client's not ready to get sober, if you can get the family to change what they think and what they do, the client sort of has to kind of do what's going along. So if you get the family to cut off the money and cut off the assistance, the first thing is it's uncomfortable. Now they have to figure out how to continue their habit, which leads them to pawning and stealing and lying. And that gets old. When you're dealing with heroin or opiates, it's a full-time job. You go from getting up and wanting to get high to getting up and going, I just don't want to get sick. So now it's a whole new process, and it's difficult to maintain any kind of job or relationship if that's all you're doing is med seeking consistently.
Yep. It's so true. So I love some of the comments coming in. I want to read one of them and address it because I just think it's really important. This person said, why the labels? Why not people first? Why junkies and addicts? And I have to tell you, my book starts with a scene where I'm speaking to a group of addicts, and I'm so judgmental and I'm so angry because of my past. And I didn't realize I had that much baggage. And so it starts with me calling them junkies and addicts and being very derogatory, because I was being honest, because it was a very vulnerable moment for me because of my own pain. And then there's an evolution through the book where you realize exactly what this person said. And so one of the themes in my book is it's easy to call people bad. It's harder to ask why. And so it's really about, so I want to address why we said junkie and addict. It's because, like you said, that, I mean, for me, it's because that title is how people see it. And so it grabs people's attention, so they'll actually read what you have to say. Like you said, your competitor tried to use it in a derogatory way, but you took it and flipped it, right? So I think that's really important. And also, in my case, it was about the evolution of learning about that I was actually using those labels as a protective reflex. So there's a lot, I really appreciate what that person said. So I think that it's fair to say, I know at Amen Clinics, we treat, there's not one reason that things happen. There's not one reason that someone falls into addiction. And so I just want to address that. It's easy to call people bad. It's harder to ask why, and behavior is complicated. What would you say to that?
I agree with that. I mean, my whole goal, I think everybody on some level can be addicted to something, whether it's sugar or caffeine or cigarettes or, social media, Facebook, TikTok. In some level, everybody has the ability to be addicted to something, and it may not be detrimental. You may not get arrested for playing TikTok all night long. You'll just wake up and not have a good night's sleep, but it's affecting you in some manner.
Of course.
So I don't think addict is a derogatory term. I think it's more, it's kind of, everybody has a tendency for that. With junkie, I wanted something stark. I wanted something, out there that kind of said, wow, what does that mean? And then as you start to read it and you kind of get to know me and get to know my husband, you're like, well, he's not really a junkie. He just had a habit. So it kind of destigmatized the word. Right. And a good friend of mine, Vera Tarman, did food junkies and sugar junkies. And she did 2 books on how you get addicted to food and sugar. And she had the exact same problem. When people said, you can't use the word junkie. And she goes, why not? He got you to buy the book. And everybody kind of went, well, yeah. And then after I read it, I realized that's not what you mean. It's more like, kind of stark and out there. It kind of breaks the stigma up a little bit.
I agree with you. And I think that when you can get someone's attention and make them pick something up because you've got something important to say. We call it clickbait, in social media, but there are times when that is appropriate. I think there are times when you're trying to get someone's attention, and sometimes being a little bit in your face is the way to do that. I think it's a really interesting thing. And I love that you took that and sort of flipped the script on it. So my husband has a book, The End of Mental Illness. That was his most recent book. And he got no end of grief for saying that you could end mental illness. And he's like, no, what I'm trying to say is we need to stop using that label. We need to destigmatize it. We need to think of it as brain health, because until we do, people aren't going to get help. And so, titles are meant to grab your attention. Labels, I agree with the person who said, that the labels, it's people first. I agree. But I think if you understand from the perspective of someone who's been hurt and before they've done the work, you get pretty judgmental. And I think it's our responsibility on the other side of it to do that work. You clearly did. You're still married after 10 years, even though you're a therapist. That can't be easy. And so you have to do work on yourself.
it's also, you have to meet the client where they are. So if a client identifies as an addict and they come in and say, I'm an addict, as a clinician, I meet them where they are. And I say, okay, I don't have to say you have substance use disorder if they identify as being an addict, because I want them to be comfortable. If they come in and say, I have substance use disorder, then I'll use that terminology with that particular client. But I let them kind of set the stage of where they are and how they feel.
There's someone saying that they are living this now. So I would highly recommend that you get help. Thank you for being vulnerable. And I think, Dr. Estes's book, I Married a Junkie, is probably going to be very helpful to you. And if you need more help than that, we certainly have 8 clinics. I think do you still practice in Miami?
Yeah, I do. I'm actually global. I created a new thing where you bring the whole treatment concept to the client, and it's called Sober on Demand. So instead of having to go inpatient for 30 days, I can bring the entire treatment team to you in a shorter span because we're in your space. So that's what I've been sort of doing lately. And I have a school to teach people how to become a recovery coach and interventionist, and that's called the Addictions Academy. We're now in 24 countries, and we just got picked up as the #1 in Canada. So it's been pretty busy, which is good.
Wonderful. Congratulations.
Yeah, thank you.
That's fantastic. So these are just amazing comments coming in. I love when I see people reaching out and talking to each other on these chats, because it's just, I think it's, pain shared is pain divided. And it's, if social media is the way you have to do that initially, great. If that's how you start to own your stuff, but get help, please. Reach out for help. And I just love, someone is saying, is there a way to turn on captions on the video? I don't know if we can do that. We'll figure it out. I'll work on that for Kathleen. But these are really good. And if you would like to see some of these comments later, we'll send them to you, or we'll forward them to you. Okay. So how long has Tim been sober?
Almost 4.5 years, roughly.
Fantastic.
Yeah.
Well, congratulations. That's amazing.
Thank you.
And this is a hard question, because as somebody who's dealt with this in my family, this has been the thing I struggle with. What will you do if he has a relapse?
That's tough, because you always say one thing and then till you're in the situation.
Yes.
So I would probably do everything I did again, unless, it was really, really bad and I just couldn't deal with it mentally, then I may walk away. But until that happens, it's kind of that thing where I really don't want to think about it because I don't know. That's the best answer. Until you're in it, and then, if I have things going on and I'm trying to work with the company, it might be too much for me, and I might just say, I can't at this time.
And I can totally understand that.
Yeah.
And to people who are watching, who are saying, they're admitting right now that they're struggling with addiction, one thing that I would say to you is, for the people on the other side, for the people that, and I would love to hear your response to this, for the people on the other side, I'm not a trained specialist. So for me, I'm not an expert in addiction. I'm a trauma nurse. People come in with their skulls split open, and I'm good with blood and guts. I am not good with the emotional stuff when it gets crazy, when there's chaos, because I grew up with that. So I learned to shut that out. And so when I was helping family members with addiction, I could handle all of the hard stuff that went with addiction, except for the lying and it's the breaking of the trust. So I know that that's actually part of the addiction. But if I could say one thing to people watching, it's like, if you can do anything to help your family members, it's start to learn to be honest when you are struggling. Start to learn to be honest. I know that that's easy to say, but what would you say to that?
It's a good point. It's a good starting point, because if you don't realize you have a problem and you continue to lie to them and to yourself, you're never going to get the help you need, and you're never going to reunite that family unit. And it's going to continue to be the same thing over and over and over again until somebody in the family either just gives up and says, do what you want, and the person overdoses, or the family says, that's it, I've had enough, I want you out, get out, and they kind of split up. So if you can agree and say to yourself, you know what, I do need help, and then get the professional help. And also the family should have a family coach or family therapist to deal with all the trauma and the remorse and the guilt and all the enabling that's going on. Because taking the addict or the person with substance use disorder out of their environment and throwing them in treatment and not fixing the environment does nothing. As soon as that person comes back, they're going to be right back in a toxic environment where the enabler continues to enable and then goes, I don't know why you're not sober. So it's a full gamut approach.
I love that. And I'm looking at some of these comments and they're so amazing. I'm trying to move this up. Okay. There's someone who's saying she lost her only child, her 24-year-old. She put a great amount of time, research, energy, and not only being with him through this, but post-surgery. So yeah, there's a lot of stuff. And he ended up on opiates. And he said, I mean, these are so tragic and so heartbreaking. So she said she's not new to the game. She's exhausted, in pain, and missing her child. The doctor won't even comply with furnishing me with many times requested prescription history for a child. I'm reading a lot of these, and these people are writing in who are just in pain from dealing with kids that, I mean, this one lost her son, and I think what I'm hearing her say, she said, why are some people hijacked more so by addiction and particular substance based on multifactorial assessments, which will be like, she's asking why are some people more hijacked by it than others? So I know if I have a glass of wine, I don't want more than that because I don't want to lose control. I hate losing control. In fact, maybe to an extreme. If my sister has a glass of wine, she's going to go polish off a bottle of vodka.
So that has to do with childhood. So it has to do with childhood and it has to do with trauma. So it's very, very interesting that you two grew up together, right? You have the same...
No, she's my half-sister. We actually did not grow up in the same house.
Okay. So you have to look at the environment that you grew up in and how you handled stress. What was your reaction to stress and trauma? If you need to be in control, that's how you handled your environment. If you're in control, you feel safe. You feel okay. When it comes to addiction, you don't want to be in control. Anything that makes you feel uncomfortable, you want it to check out.
Yes.
So you see different personalities on how they handle stress using coping mechanisms. Plus, there's also a genetic predisposition. So if you have somebody who's predisposed to alcoholism or drug addiction and they try it, what's going to happen is their body says, ooh, I like that. And then it's also different drugs. For example, for me, I got hooked on diet pills because I was overweight in college and I went to the doctor and I said, I'm basically binging. I'm eating and working out, not eating and throwing up and yada, yada. And back then, there wasn't a disorder in the DSM that fit my problem. So instead of saying, well, this might be psychological, it was you're just fat. And they sent me to the fat doctor who put me on fen-phen. And I ended up with heart palpitations, and that led me to diet pills, to Dexatrim, which then led me to speed. And I ended up in the ER thinking I was having a heart attack.
Right.
And I said, okay, what do I do? Well, there's no answer because technically you don't have an eating disorder. Now you're an addict. So they hand me a pamphlet for OA and a pamphlet for NA. And I'm going, what am I supposed to do with this? I go to OA, they have no food. I go to NA, they have sugar, they have caffeine, they have cigarettes, and I'm so confused as what's going on. But for me, I don't like to go down. So I don't like morphine. I don't like opiates. I don't have a glass of wine and that's it.
Yeah. I'm with you. And it's funny that you brought that up. Like, it depends on your childhood because there's probably there is so much to that because I grew up in a home where we both grew up in very chaotic environments, but my uncle was murdered and he was murdered because of my other uncle who did heroin. And so it wasn't him that was the addict. It was my other uncle who now is an amazing person. But at the time I was terrified of him. He reminded me of Zombie, him and his girlfriend. I was so scared. They so effectively instilled shock therapy into me that now he actually says that's the one positive thing that came out of that for him. But my other uncle was murdered because of that. So I learned early on that my environment was chaotic and I had to control it or it was going to be scary. So it's funny that you said that because you touched right on that.
Yep. And that shows why you're not predisposed to wanting 2, 3, 4, or 5 glasses of wine because you're thinking to yourself, if I do that, I'm out of control. What bad thing is going to happen? If I'm in control, nothing bad is going to happen because I can remove myself from the situation. So everybody's coping mechanism is different. And
Yeah.
when you have different people, it's different drugs. For example, for my husband, it was the opiates. The opiates were great for him. He's like, I love this. I can veg out, but I can still kind of work. And they gave him energy. For me, I'm like, any kind of morphine, down or no. I don't want to sit and drool all over myself. I want to be productive. So it's sort of how your body processes it as well.
Yeah, so interesting. So your marriage, is your marriage stronger today, or is it as good, or did you suffer some dings along the way? What would you say?
Lots of damage, lots of trust issues. It's difficult to trust somebody when they lie consistently. And I mean, there's a carjacking. So at one point he had the car jacked and called me from the hospital and said, come pick me up. And he had no shirt on and no shoes and didn't want to tell me that he got the car stolen. So some of that's hard to overcome when it's long-term lying and long-term deceit. But you start to learn how to overcome it slowly and work a little bit better together.
We've got 2 minutes left. What is the one tip you would tell people that they can take away today, if you could tell them anything?
If you're using, you can stop. If you're using and you're stuck in the rut, you're stuck on the hamster wheel, reach out, get help. There is help. There are people to help you. Even if your immediate family's had enough and they don't want to help you, professionals will help you. That's what we do. And if you're in a family situation where you have a family member that's using, reach out for help as well, because we will help you. We can help guide you on how to handle the situation. And maybe your loved one isn't ready to get sober, but if we start having you do little things now, it'll force them in the direction of getting sober. So yes, we are here to help you. We don't judge. We're not going to judge your situation. We've seen it all, heard it all.
You've seen it all, heard it all. Exactly. So I really want to, let me just, if people want to reach out to you, it's CaliEstes.com and theaddictionacademy.com.
Yep, or theaddictionscoach.com or soberondemand.com.
Oh, wow. Okay.
And the book's on Amazon, and it's also at imarriedajunkie.com.
Perfect. Excellent. So if you are struggling with addiction, I agree with you. Please take Dr. Estes' advice. Seek professional help. It's just so hurtful to you, but also to your relationships. And I love what you do. We call it hardware, software. So we scan people's brains. We look at what's going on there. Did they have a head injury? Do they have, is there something else happening? There's lots of reasons people get depressed. There are lots of reasons people get anxious. There are lots of reasons people struggle with many different things that they struggle with. It's not all one simple or single disorder. And so we scan the brain. We call that the hardware. We look at it through the biology, the psychology, the social, the spiritual. But the scan gives us the biology, like what's happening. And then getting help, it's mandatory, it's necessary. Like you've got to have someone helping you, a professional, and that's the software. Teaching you to reprogram how you think, what you do, change everything you're doing. And so I love that. So if you are struggling and you feel like you need a scan, please reach out to us. We're happy to see you at Amen Clinics, 844-818-0616. You can also go to TanaAmen.com for some of my blogs, but please reach out to Dr. Estes. She clearly has not just professional opinions on this, you've lived it. So that's one thing that my husband and I, when I was helping my sister, we were getting my nieces out of foster care, and he was at a very different place with this journey than I was, because I grew up with a lot of chaos, a lot of addiction, and everything that goes along with that. And he grew up in this amazing family. So, he kept saying, why are you so scared? Like, I'm a professional, I can handle this. I'm like, you handle this at work and you come home. I get that you're the professional, but I'm the professional. I'm the expert when it comes to crazy in my family. I've lived a long time. It's very different. Yeah. And so we had to learn together how to not get frustrated with each other and respect each other's boundaries. Cause I'm like, you just didn't grow up with this like I did. And it's terrifying. So there's a lot that goes into it. So I would really recommend people go online, find Dr. Estes. I really have appreciated this interview. And really quickly, if I could, I want to announce, we always tell people that if they will go on and post something that they've learned, tag 3 friends, it will enter them into a drawing for my Brain Warriors Way course. And I'm super excited that we can announce winners today, Kathy Brooks Campbell and Abby Stockdale. And Abby Stockdale also gets a free consultation with Jim Fay, who we had on for our parenting program. that is just, if you are having trouble parenting, Love and Logic like saved my life. So you get to have that. We are so excited for you. Thank you so much, Dr. Estes. I appreciate your time today. Hopefully we will have lots of people reaching out to you who either need help themselves or for someone in their family. I just am grateful that you came on my show.
Thank you. Thanks for having me. Nice
Absolutely.
to meet you.
And don't miss next week, next Wednesday, same time. We have another surprise for you, another expert, and we're looking forward to it. Have a great day.